Welcome back to the Superdoc Insights, where we explore the profound lessons that life in the ICU teaches us about ourselves and the world. Today's topic hits close to home, not just for medical professionals but for all of us. I am going to talk about a recent case of a young woman who presented to the ICU with what initially looked like a severe respiratory issue, but upon further inspection was potentially a case of Munchausen's. It's a story that made me reflect deeply on attention seeking behavior, not just in extreme cases like this, but in the subtle ways we all seek validation in our everyday lives. I was on call when a young female patient was transferred to the ICU with sudden respiratory distress. She had given birth to twins a few months ago through IVF, had a history of pancreatitis a year ago, and the entire medical team was on high alert due to her postpartum status. Given her rapid breathing and apparent distress, the family was convinced she was going to die, which only added to the intensity of the situation. I ran a full battery of tests: bedside ultrasounds, CT scans, blood gases, you name it. To my surprise, every report came back normal. I began to question myself. How could a patient looking this sick have such clean results? Something wasn't just adding up. But I decided to hold off on intubation, trusting my instinct, although she was severely tachypneic. Then I noticed something curious. Her symptoms worsened dramatically whenever her family was around. After some observation, I asked the family to leave the room, and that's when things began to shift. The patient's breathing normalized, and during our conversation, I realized there was a lot more going on beneath the surface. As we spoke, she revealed her feelings of loneliness and stress, being overwhelmed with twins and dealing with the financial and emotional strain of her family's past trauma. She wasn't in physical distress, she was emotionally exhausted. The more we talked, the more she opened up, and by the end of our conversation, she was calm enough to sleep without any medical intervention. It made me pause. This could be a case of postpartum depression or Munchausen syndrome. But before I hastily labeled it, I asked myself, how much suffering must someone endure to feign such symptoms just for attention? The need for validation, to be seen and cared for, must have run so deep that her body was manifesting these intense symptoms. This case made me reflect on something larger: how we all, to some degree, exhibit attention seeking behaviors in our own lives. Now, we might not fabricate illness or symptoms like Munchausen syndrome, but the patterns are still there, just in more subtle forms. Think about it. Social media, for example, is a breeding ground for attention seeking behaviors. We post pictures waiting for likes and comments, subconsciously tying our self worth to how others perceive us. And it's not just the social media. We seek validation in our careers, craving recognition from our bosses and peers. Even in relationships, we sometimes stretch ourselves thin, doing things not because we want to, but because we want to be noticed or loved. This patient's case made me reflect on my own need for validation. There were times in my career when I sought praise and recognition from seniors, and when it didn't come, I questioned my worth. I realized that, like my patient, I too had moments where I craved attention in ways that weren't always healthy. We often don't realize it, but this craving for attention activates the same dopamine pathways in our brains as any other reward system. Just like my patient's family believed she was in danger, we sometimes convince ourselves that without validation, we are less worthy. I think the most significant takeaway from this case is understanding how our actions and motivations are sometimes driven by the subconscious need for attention. It might not be as overt as a Munchausen syndrome, but it's there. Whether it's checking for likes on the social media, working extra hours to get noticed, or even craving affection in ways that lead to emotional burnout. This experience left me pondering over some difficult questions, and I want to share them with you. Let's take a moment to reflect. Where in your life are you seeking validation that might be driving you toward burnout? Are there areas where you feel unheard or unnoticed? And are you overcompensating for that in unhealthy ways? Do you find yourself addicted to the dopamine rush that comes from attention, whether it's through social media, work, or relationships? How are these patterns affecting your mental and emotional health? Recognizing these tendencies in ourselves is the first step toward breaking free from them. It's about finding a balance between the external validation we crave and the internal sense of self worth we need to cultivate. As we conclude today's episode, I want to leave you with this thought. Seeking validation from others isn't inherently wrong, but when we rely on it too much, we risk losing sight of our true selves. Whether it's through social media, habits, or deeper emotional struggles, the quest for attention can become consuming. So, take a moment to reflect on your own life. Where are you allowing this need for attention to take control? And how you can shift from seeking external validation to nurturing internal growth and self acceptance. Thank you for tuning in to the Super Talk Insights. Stay balanced, stay healthy, and remember your worth isn't measured by the attention you receive, but by how deeply you connect with yourself.